Dr. Ami Date. I'm a consultant obstetrician gynecologist endoscopic surgeon practicing in the city of Pune, and today I shall be throwing some light about preterm labor. Preterm labor is defined as any labor which happens before the 37 completed weeks of pregnancy. Having known the definition, it is usually classified as late preterm when it happens between 34 to 37 weeks, early preterm when it happens between 32 to 34 weeks, and very early preterm which happens before 32 completed weeks of pregnancy. Why do we need this classification is, it is this early preterm and very early pretermers who land up into neonatal NICU, and they have a lot of complications later on, including respiratory problems, they have temperature control problems, they face repeated infections, and overall they do not have a very good perinatal outcome. Knowing about the classification and the definition, let's move on to the risk factors. The most important risk factor is overdistension of the uterus, which can be seen in cases of multiple pregnancies or when the liquor in the uterus is in excess amount. Second is whenever we have an inherently weak cervix, which is often given in the history of the mother, suggestive of a mid-trimester abortion in her previous pregnancy. Any lady who's coming with recurrent pregnancy losses also becomes a high risk. Often ladies give history of repeated vaginal and urinary tract infections, which also makes them a little high risk. Knowing about the risk factors, let's move on to the prediction. The prediction of preterm labor is mainly done on a very good history of the previous pregnancy outcomes. And of course, a good cervical length screening done in the early second trimester by a transvaginal ultrasound. So, knowing about the prediction, let's move on to the prevention. To prevent preterm labor, we have two mainstays of management. Number one is medications, and the second, which is reserved for a very small group, which is mainly putting in a cerclage. So a cerclage is nothing but a stitch which is done at the junction of the uterus and the cervix, usually when the cervical length is less than 2.5 centimeters or the woman is giving history of a previous mid-trimester loss. For rest of the others, the mainstay of treatment is natural micronized progesterone, which is given as a long-term therapy, continuing up till 34 weeks of pregnancy. So most of these women have shown proven benefits when they have been put on NMP or natural micronized progesterone. So here, I urge all the women to go ahead with their regular antenatal checks and go ahead with the cervical screening to prevent preterm birth. Wishing you all a very safe and a very happy motherhood. Thank you.